Good afternoon, everyone. Welcome to our webinar. Before we start, I would like to introduce we are having some more webinars in next week, next Monday, next Tuesday, and next Wednesday at the same time, 2 p.m. So you guys can stay tuned in our Facebook page and YouTube. For the Wednesday webinar, it is done by Dr. Tan, our Dean of School of Pharmacy, with the title Empowering Health Professionals in Pharmacies, Leading Smoking Cessation Sports. And our Tuesday webinars is by Mr. Anand, and with the title Role of Pharmacies in Modern Insights and Future Directions. And our Wednesday webinar is Stay on Track, Mastering Medication Adherence. So this webinar is in conjunction with World Pharmacist Month Celebration Year 2023, KPJ Healthcare University. I am Liu Xuning, currently a student from Bachelor of Pharmacy, and on behalf of the School of Pharmacy, KPJ Healthcare University. I would like to extend a very warm welcome to all of you. Thank you for joining us today. We appreciate you by taking time off your busy schedules to join us today. We hope you will enjoy the session and also gain a lot of information from our session today. And also, the theme of World Pharmacist Day 2023, which is on 25th of September, is Pharmacies Strengthening Health Systems. This day has been celebrated since year 2009, when it was first created by International Pharmaceutical Federation to honor pharmacists and their contributions. Pharmacists have an important role in society as they dispense drugs, provide advice on drug interventions, offer health screenings, and more. So, World Pharmacist Day is a moment to appreciate the incredible work of pharmacists. Moving on, I would like to introduce our speaker today, Madam Bama Vivi Menon. Madam Bama is a registered Malaysian pharmacist with 23 years of working experience in various pharmaceutical fields, such as retail, manufacturing, hospital, and academics. Also, she is the Deputy Dean and Senior Lecturer of the School of Pharmacies of KPJ Healthcare University. She joined KPJ Healthcare University in year 2014 and completed her Master in Clinical Pharmacy from CUCMS Cyberjaya. She is also a member of Malaysian Pharmaceutical Society and Yoga Alliance International. Next, I would like to invite our speaker, Madam Bama Vivi Menon, to start her webinar with the title, Medication Treasure Box Expiry After Opening.
Thank you very much, Ms. Liu. A warm welcome and well wishes to all the viewers today. I would like to take this opportunity to wish all the pharmacists out there World Pharmacist Day celebration wishes. Yeah, but I think the world of pharmacy is not just about the pharmacist. It comprises of many people actually. So a lot of people make the job of a pharmacist possible. For example, pharmacy assistants, researchers, scientists, chemists. So all these people actually enable us to use medications for patients. All right. So I would also like to take this opportunity to wish Happy World Pharmacist Day, Pharmacy Day to all the people involved in this field of pharmacy. All right. Now, I'm a pharmacist and I've been with KPJ. This is my 10th year. So I take a lot of pride to represent KPJ University, to share the knowledge that I have that could benefit you with this title, yeah? Medication Treasure Box, Expiry After Opening. Now, why I chose this topic, it's a very unique topic, but it's very, very close to all of us. Because in every household, we actually keep medicines. Some of us keep a lot of them, some of us keep very little. So the difference is just usually in the magnitude and the quantity. So how we keep our medications, how we manage them, how we even throw them out, I think is very crucial to everybody. So today I'm going to try my best to share a little bit of this with all of you out there. Hopefully you enjoy this webinar and you gain insight on how to manage your medication after this. All right. So today, throughout this webinar, we will cover a few aspects. All right. First, we will talk a little bit about medication storage. Why is that so important? And also, what is this thing called expiry date? Where can we find it? And what about expiry after opening? This is not new, but it should be something all of us know about. Not many people are aware about expiry after opening. And also, finally, I'll conclude by saying a little bit on how we can dispose drugs rationally and responsibly. Okay, maybe along the line, I'll try to be a little bit bilingual. I'll try to mix Bahasa Melayu so that some of our viewers can actually appreciate. Okay. Nah, di semua rumah kita boleh dapat storage sikit, at least sikit lah ubat-ubat yang kita simpan ya. Mungkin ubat tu pernah digunakan sebelum ni, mungkin ubat tu adalah ubat yang ada lebihan dia ya. Tapi semestinya setiap rumah tu mesti simpan sedikit lah ubat. Dan ubat-ubat ni ada banyak bentuk dia. There are so many types. Syrup, tablet, capsule ya. Ada yang kita simpan dalam peti sejuk, ada yang kita simpan dalam almari ya. So if you look at these medications, temperature and humidity lah, ya, suhu serta juga kelembapan ya. Dua faktor ni sangat banyak memainkan peranan dalam kualiti ubat kita. Alright. So in terms of color, taste and smell, temperature and humidity can affect our drugs and change these three parameters. And this change atau perubahan ini mungkin akan membawa dua kesan. Pertama, effectiveness can be reduced. Mungkin efikasi dia mungkin menurun, ya. Efek dia pada badan kita menurun, ya. Dan secondly, it can be harmful. It can bring some side effect or dangerous effect to the body. So this is basically how temperature and humidity can affect our medication. So, ladies and gentlemen, tuan-tuan dan puan-puan, how do we store medicines? Should we keep it in a certain way? Where do we keep it? What kind of container? All these are questions that maybe appeared in our mind before this, but most of the time we don't really think so much about this. Sometimes we dump all our medication into a big Tupperware and push it into the fridge. Or we just put it in one of our working drawers. Sometimes we store it properly, sometimes we, but I think in today's webinar, we should pay some attention to this. And hereafter, maybe we can manage our medications in a better way. So ladies and gentlemen, those of you out there who are always on the go, you know, like people who are working as marketing executives, marketing managers, CEOs, always having meetings here and there, flying here and there. Should we store our medications in our glove compartment? It's always there. We are driving around, so easily accessible. So what do you think, ladies and gentlemen? No, because our car usually gets very heated up, right? So high temperature can actually spoil your medications, right? And we are afraid that two very clear effect might happen. First, your drugs may lose the efficacy. So you're supposed to take it for something, maybe for pain and no effect. Or it's an antibiotic, it may lose its action. Second, it might give you other negative effects, diarrhea, stomach pain, you know, other effects that we don't want, okay? So don't store your medications in the glove compartment. What about in the bathroom? So many of us who watch, you know, if you watch a lot of English movies, you notice that most of the time, their medications are in the bathroom, in a cabinet, right? So can we do that? What do you think? Okay, now if you want to think about this in a broader scope, you can actually think about how your bathroom is managed, basically, how big it is. Now, if you look at the Western regions, usually their bathrooms are not, the floor is not usually wet all the time, right? But in the Eastern culture, usually the bathrooms are wet areas, right? So I would strongly discourage you from doing that. Please do not store your medications in the bathroom for whatever reason. All right? Why? Because high humidity. And we live in a country, in a tropical country, always receiving a lot of rain, and it's hot and rainy throughout the year. So our humidity levels are high. Okay, so ladies and gentlemen, let's not keep our medicines in the bathroom. Can we store them in the kitchen? This is another very popular place because sometimes some of us actually spend a lot of time in the kitchen preparing meals, and so on. But don't forget, the kitchen actually is a place that generates a lot of heat. For example, we have stove over there, we have our ovens, even our fridge actually lets out heat, especially the back area, right? So there's a lot of heat generated in the kitchen. But after having said that, I would also like to remind you that some kitchens are very big. So not necessarily that your medicines are very near to the stove. It can be away, right? As long as you don't put it in areas that are very high temperature or has a risk of excessive heat production. Okay, now let's look at the conditions that is required to store medicines. All right, ladies and gentlemen. So firstly, cool place. Now, cool and cold is two different things. All right. Cool is about up to 15 degrees. Cold could be lower than that. So you should have an ideal place that is cool and low humidity, not dry. And for the temperature part, you should check the information regarding the drug that you are going to store. Because temperature actually varies. What storage temperature we need to put the drug in varies accordingly to the drug. And lastly, humidity requirements. So this one also you can find the information related to the medicine. So temperature storage guidelines, where can we get this information? If you buy a pharmaceutical or a medicine, usually it comes with a label. And if you open the packaging, inside you find these package inserts. So if you want more detail, you can find those information over there. All right. But of course, in some scenarios, the label states very clearly in terms of Celsius, like for example, 2 to 8 degrees Celsius. But in some packaging, they'll just use words like store in ambient temperature. Then you may become confused again as to what does ambient temperature mean. So I'm going to share here some of the words and the temperature range associated with that. But I would like to pay attention to specific words like refrigerated. If someone says, please refrigerate your drug, it means we are looking at about 2 to 8 degree temperature. Store in a cool place is about 8 to 15 degrees. Cold, below 8 degrees. So refrigerate and cold, it can actually be used synonymously. Yeah. And then room temperature usually is up to about 25 degrees. What about ambient temperature? Now, ambient temperature is something like room temperature, but it can go slightly higher up to 30 degrees. Okay. And other than that, those are not so common. So commonly used ones are like what I mentioned just now, to be refrigerated, ambient temperature. Why is it that we need to store medications appropriately? Because we want the drug to be stable for a long period of time. Okay, because some drugs, not some drugs, most drugs are expensive. All right, and when you buy them, you want to make sure that you can use them, right? You can use them without any stability issues. And when you keep them for later use, you want them to be stable. So storage basically will determine the stability of your product. So first thing that affects drug stability is usually temperature, light, humidity, and air, the environment of the storage area. All right. Secondly, what is in the drug? The active as well as the excipients or the other ingredients. Okay, bahan aktif dan bahan-bahan sampingan that is used to make the drug. Okay, now these active and excipients, they have their own characteristic, all right? But that characteristic also determines the stability of the drug. Thirdly, the whole manufacturing process. How is the drug actually made? All right. So this also will affect the stability of the drug. Now, my question to you, ladies and gentlemen, which one of these factors is under your control? Do you think you have any control over the manufacturing process? Definitely no, right? Because it's already manufactured when it comes to you. Now, do you have any control about what is the ingredient that is put in the product? Obviously not. So the only control that you and I have over the stability of the drug is the temperature, the light, the humidity, the air, the environment of the drug itself. That is well within our control. Yes, ladies and gentlemen? So please, we all have to remember this. It's very, very crucial to actually follow storage instructions very, very diligently, right? Okay. Now, ladies and gentlemen, where can we get this storage information? Where do we find this info that says store in a cool place, keep in an ambient place, refrigerate? Number one, you can always find it on the label of the package itself. When you receive the package, look for that information on the label. Package insert. Sometimes the label is too tiny for them to fit all this information, right? So you can always open the packaging, take out the package insert and read further so you can get even clearer instruction. All right, guidelines. So guidelines like FDA, WHO, they also tell you to a certain extent how to keep your medicines. Even the portal Health in KKM, right? But ladies and gentlemen, when you have us pharmacists around, why do you worry? Ask us, because we will know how to advise you. We will actually know where to look for this information and we can actually educate you on that. So don't worry. The next round you go for your medicines, ask your pharmacist, where should I keep this drug? Okay, very few patients, even in my experience, I have not come across a patient who actually asked, where should I keep this? We take the initiative to tell them because, example, when you dispense insulin and you tell them to keep it in the fridge, they rarely ask you before you tell them, So I think let's increase our awareness and let's play our rights as patients as well. Ask your pharmacist, where should I keep this drug? Can I keep this tablet here? Can I keep it there? Just ask this question and be informed, right? Let's become an informed society. For example, now, in this label, if you look at the arrow that I'm pointing at, it states the temperature 35 to 46 degree Fahrenheit. Now, Fahrenheit, Celsius, don't worry. You want to convert, just go to Google and use a calculator and convert it. Not a problem, right? So, but the label carries the information. So that's what I'm trying to point out here. Apart from that, like in this box itself, you can see that you're supposed to store at 2 to 8 degrees. Okay, so these are some places that you can get your information from. Now let's move to where is a good place to keep our medicines at home, right? Now, number one, you can keep your medicines in the bedroom, okay, or kitchen. Okay, I remember saying not in the kitchen earlier, but in the kitchen, if you can keep your medicines in a cabinet away from heat areas, then it's fine. All right, but it must be a spacious kitchen. If your kitchen is very small, then I think you better opt for a different room in your house. Okay, now make sure in that room you have a particular cabinet or a small cupboard for these medicines to be kept. Okay, if you need to refrigerate them, don't just throw your medicines into the shelf. One strip here, one box there, an inhaler here, whatever not. Don't do it that way. Put your medicines into a container, close it, and place it in the middle rack of your fridge. Not near to the freezer, Some fridges have the freezer at the bottom, so not close to the freezer and also not on the door. Don't place it at the door of the fridge. Now, why? When you place your medicines very near to the freezer, the extreme cold temperature will actually affect. Number one, when you place it near the door, every time you open the fridge, there'll be temperature fluctuation, and that will affect the drug as well. Okay, that's number two. Okay, now another reminder where to keep these medicines is definitely in a higher place or locked area to keep away from kids. Now, if you have children who are teenagers and young adults, that's fine because you can educate them that they're not supposed to simply access these medicine cupboards or drawers. But if you have very small kids, they may not understand and they may always, and they may access these medications. Okay, there has always been historically reported cases where children swallow tablets or consume medication accidentally. So this is very, very detrimental. So please bear in mind, keep it in a cabinet. If possible, keep it in lock, in a locked cabinet. Make sure you can actually lock it. And if it's higher than the areas where kids are accessing, it will be better. And another important reminder is try to keep your medications in the original container from the manufacturer. Some people like to take out the whole medicines out, discard all the packaging, and then they just keep the medicines. Now try to refrain from doing that. Why this is important, I'll let you know. Sometimes when the patient who's consuming the drug, they may know a lot about the medication, but let's say they are not available or they have fainted or they have become unconscious. Now somebody else has to actually report uh, information related to their medicines to the medical team, right? So when they want to search for this kind of information, if it is in the original container, it would be very good for the medical team to actually identify as well. Otherwise, you'll be wondering, oh, it's a yellow color tablet, it's a blue color strip, but the information given would be very confusing. It may waste the medical team's time before they can diagnose the patient or help the patient. So this is why we should keep the original container. Not only that, sometimes you see the original container also carries the expiry date. So that's also very important, yeah? And please don't keep your medicines in the bathroom, no matter how big is your bathroom. All right, because humidity issue is real. That is an issue in Malaysia, right? So let's not the bathroom. Follow temperature requirements, yeah, ladies and gentlemen. I already told you earlier where we can find this information. Worst come to worst, and store your medication according to that, right? According to that. Example of unused insulin, okay, like eye drops, ear drops, suppositories, reconstituted antibiotics. Now, these are some of the drugs that you may need to keep in the fridge. Okay, unused insulin is one of them. Eye drops, whether you have opened or not opened. Okay, ear drops, suppositories, and reconstituted antibiotics. Now, reconstituted antibiotics refer to antibiotics that has been mixed with liquid. Okay, usually the powder form, and then the pharmacies usually will reconstitute the first bottle for you. And then they will educate you how to reconstitute the next few bottles. So the one that's reconstituted, you have to keep in the fridge because the expiry depends largely on that. All right, the stability of the drug also is affected by the temperature. Say you're traveling a lot. Some of us travel all the time. So if you're traveling and you need to bring medications, please don't use the glove compartment as a storage area. Bring a cool bag. Put an ice pack in the cool bag, but put the ice pack in the pockets. Don't allow the ice pack to get into contact with your drug directly. Okay, no direct contact between the medication and the ice pack. Okay, but you can put your medicines in a cool bag and travel with it. Okay, so hopefully these tips on how to keep medicines has actually given you some eye opener, all right? Okay, now we're going to move on to another important area, which is expiry date. Okay, I think expiry date is not something new. I don't have to introduce this to you because even when we buy our kitchen items, we look at expiry date. Bread, your canned foods, right? So expiry date is not something alien to us anymore. But let me just explain to you, expiration date is actually how long the manufacturer of that medicine is guaranteeing the full potency and safety of that medicine. Okay, that means they are guaranteeing it till that day of expiry. Beyond that, if you continue to use the product, there is no guarantee on the potency, safety, efficacy, or even the benefit of the drug. There's no guarantee. Okay, so drug expiration dates you can find on not just prescription items, like the drugs that the doctor prescribes, but also sometimes you can get it on the medications that you buy over. Sometimes you go to the pharmacy, you just buy tablets over the counter, right? Those tablets also will carry expiry date. Even herbal and supplements, vitamins, all these also has expiry date. Okay, so these expiry dates denote one important information, which is until that expiry date, the quality of the product is guaranteed. Beyond that, no guarantee. Okay, I think all of us have seen expiry dates, right? Okay. Now, some expiry date they give you up to the day. Like for example, this one up here, which is 9th of November. Okay, it's manufactured 9th November 2016, expiry 9th November 2018. So which means that until the 9th of November, you are able to take this medicine. Okay, on the 10th of November, this medicine is considered expired and not safe for you to consume. You are consuming it still, then it's at your own risk. No guarantees. All right. Okay, now some expiry date just carries the month. Then you're wondering, okay, very good popular question. Should I discard it on the first day of the month or should I wait until the last? All right. This example you see is stated as February 2023. So I think this year, February, we had 28 days, right? So you can consume this or use this medication until the 28th of February 2023. Beyond that, please put it aside for discarding. Okay? So if you continue to take it, I would say you are taking it at your own risk. Okay? Anything happens to you, you are solely responsible for your own health. Okay. Now, today I also want to touch on something a bit different from expiry dates. Okay? Now, all of us know that when you buy a product, you see the expiry date, you want to keep that product until the last day of that expiry. Correct? But, ladies and gentlemen, there is this new concept, not new concept, there is this crucial concept called expiry after opening. It's not a new thing. It's been there for many years, just that many of us don't realize this. When we don't realize it, we are not aware of it. When we're not aware of it, we don't comply to it. So let's look at what is this expiry after opening. Now, let's say you buy a product. It says expiry, it says this is September, so 30th of September 2023, and I've opened it. Okay, I've opened it. If the expiry after opening is, let's say, 1 week, which means that I cannot keep this product even up to 30th of September. All right, so expiry after opening refers to the shelf life of the product once you open the seal. Once you break the seal, you have exposed the medication to the environment, which means that now the environment and you continuously handling the drug, the touch of the drug with your spoon, with the surface of the bottle, and all that is going to change the stability of the drug. Okay, ladies and gentlemen, so this is a very true and very real scenario, okay, that we need to take note of. Exposure to the environment is going to reduce the shelf life of the product. So now the expiry after opening is no longer the same as the print. Now you're wondering, okay, so which of my products Let's look at some examples, okay? Example number 1, tablets or strips, okay? Tablets in the form of strips and blisters like this picture up here. See this picture here? Yeah. So this picture shows that individual tablets are blistered up or packed in a strip, right? So when you open, you only open one, which means that the others do not get exposed to the environment. So in this case, you can follow the expiry of the manufacturer. Okay, it's okay to keep it until the last day of the expiry printed on the blister or the strip. But let's say you have a loose bottle of tablet like this. Now the expiry changes because every time you open, environmental air will go in and come out. All right, so you get contact with the environment already. So in this case, once you open, you should make sure the tablets are finished in 6 months. Okay, that's why usually in the pharmacy, they don't dispense more than 3 months. Okay, all right. Next, let's look at oral liquid. Sometimes you buy things like syrup, which is already in the manufacturer's bottle, or cough. Right? When you open, even though the expiry says 2 years, when you open, you should discard it 6 months later. So my advice to you all would be when you open, write the opening date on the label with a marker pen or something. Okay, stick it there, or put a note, because otherwise you will continue to use something that has deteriorated in quality. Yeah, you cannot guarantee the effect. Now, what if the liquid was packed in the pharmacy? Using this this kind of small syrup bottles. Cough mixtures or antibiotics are given like this sometimes, and these bottles are purchased by the pharmacy, so it's packed into those bottles. So because the packaging you cannot guarantee from a different manufacturer, and you are repacking, the expiry now is reduced to 3 months only. So once you open and you start using, 3 months later, please discard it. Okay, ladies and gentlemen, I hope that is clear so far. Now I'm going to go to the next one, which is also another very important preparation. GTN tablets, your glycerol trinitrate tablets. Now, many of you all will know this tablet as heart attack tablet. You put under your tongue when you have chest pain or angina, right? Now, GTN, as long as you don't open the cover, you can follow the expiry on the package. But let's say if the patient had an attack and he had to open, and used 1 or 2 tablets. After that, this whole packaging can only last 8 weeks. And take note, this is very important because beyond 8 weeks, if you have a heart attack, this tablet is not going to work. So that is why I'm saying expiry after opening is very important. Don't take it lightly, okay? Especially in situation of life-saving drugs like GTN. Okay, now next, creams. Now many of us, when we have skin rashes and skin troubles, we go to the pharmacy, we buy tubes, right? It comes in tubes. So when you open these tubes, it's now exposed to the environment, right? And every time you use your finger, it may come into contact with the skin. So 6 months after opening, please discard your tubes, even though they are not finished. That's the important point for you to remember. Next, what about creams in a jar? Some creams are dispensed in a small jar, right? So when you open, bigger surface is exposed to the environment. So meaning more contamination. So here, we limit it to 3 months after opening. This is suggested expiry after opening, yeah? Okay, I hope you are clear so far. Next, let's say you buy creams or lotions in a bottle that has a pump. Okay, now this is a bit special because when you pump, you draw the cream out. You don't draw things in. So environmental air don't really moves into the clinic, into the cream, into the bottle. So you can actually follow the manufacturer's expiry date. Now comes to the other very crucial preparation, eye drop, ear drop, nasal drop. Now this is something I've observed in many people. You buy an eye drop, you use it for your eyes, and then you don't finish it, and you keep it for years. you follow the expiry date printed on the label. A lot of people do this. Now that is very dangerous. All right. Supposedly, you should discard this product 4 weeks after opening. 4 weeks exactly, not even 30 days, and 28 days. So, ladies and gentlemen, please take note of this. Hereafter, if you buy eye drops and you open it, make sure you finish it in 4 weeks, or if not, after 4 weeks, please discard. I would recommend those of you who can buy preparations like the ampule eye drops. That will be more economical for you. You use it and discard. You don't have to contaminate a whole bottle, right? So you can go for options like this, of course. Now, use insulin, you can follow the manufacturer's expiry date. But for open insulin, let's say you've already put it into the insulin pen, usually it's 4 weeks. Okay, you can store at room temperature for open insulin. Okay, ladies and gentlemen, now the important takeaway message for this part, expiry after opening, is every product has got an expiry after opening. You have to respect that. Second, you have to discard it even though you have not finished it. Okay, maybe you feel that I've not finished the drug, why should I discard it? So if you don't, then you're using it at a risk. You have to be aware of it. Huh? So now we come to another crucial part. What to do after expiry? Now I talked about expiry date. I've talked about expiry after opening, which means that now definitely there will be something that expired. When you open your medicine box and check today, you will find there will be something expired. So what do we do with this? Discard. Definitely we have to discard it. We can't keep it. But how? The golden question is, how do we discard our medicines? So here, some people will say, oh, I flush my drugs into the toilet. Ladies and gentlemen, India Water Consortium does not clear drugs from your water. So please do not do that. Okay? Whatever you flush is going to go back to the sewerage, going to be processed back and come back to you as drinking water. So bear in mind, your medicines are all going to come back after you. So do not flush your drugs down the tablet, no matter how this, your grandmother, grandfather tells you to do it. Okay, please don't do it. Throw it in the trash. That's another way out, because trash is out of the house, out of your sight. Can we do that? No, because even our trash management systems do not take care of the drugs. They do not manage the medicines and the chemicals inside of it. So what to do? Bury it? Yeah, I've got some land behind my house. I'll just bury it there. No, please don't do that, because then now your chemicals will deteriorate and go into your water system under the ground. Okay, so no to that as well. So how do we discard our expired medicines, ladies and gentlemen? So here I'm going to share with you some tips. Now later, after this webinar, you go to your medicine box or your medicine cabinet. Open and check. Check every single thing that you're keeping there. Okay? Remove all your expired items and keep aside. Okay? Make it a habit that every month you check your medicines for expiry, for even the look of it. Maybe it has absorbed moisture and turned color. White tablet became yellow. You have to discard. Right? So check all these. Make it a habit to do it every month at least once. Yeah? If you have medicines in the fridge, in a container, do the checking also. Okay, sometimes we keep medicines in a cabinet and then some fridge items in the fridge. So make sure you check all together, all right? Separate out your expired medicines. Keep the ones in the box properly. Maybe you want to repack it into nice containers, keep it nicely labeled. You want to write the expiry date in a bigger marker pen or something. Up to you. But manage it properly. Separate out all your expired medications. Pack them up. And the next time you go to the hospital or the nearby retail outlet, give it to them. You know why? Because hospitals have a proper disposal mechanism for medications. Every month or sometimes twice or thrice a year, they actually discard this through quality alarm. And these medications will actually be incinerated. That means they will totally be destroyed properly and it will not contaminate the environment. So pass it back to the hospital. They'll be happy to take it and dispose it for you. Some retail outlets also do this. Credit goes to Alpro, they also do this actually. Yeah. Now, summary, ladies and gentlemen. I think I've taken the liberty to share a lot of logical information that you can actually apply at home. Number one, store your medications appropriately. So how and what it means by this word appropriately, I think you have to recall back about the storage temperature, right? Where to get this information, the box inside the fridge and all that. Okay, so store medications appropriately. Take note of your storage information. Take note of expiry dates. Okay, very crucial. And expiry after opening is a real thing. It's not same as the expiry date on the label. So please bear in mind, if you decide to open the medication, write the open date on the bottle or on the box. Okay? And finally, dispose your medication responsibly. Okay? So congratulations, ladies and gentlemen. I think at the end, you have actually concluded this webinar very well. You have got all the information that you need to manage your medications at home appropriately. All right. So I hope that I've delivered this information to you appropriately also. And it is my wish that you have gained an insight to how you manage your medications. My only request as a pharmacist would be, please take your medicines appropriately, take them compliantly, manage them and dispose them correctly as well. Right. Thank you so much. Thank you for listening.
That's so informative. Thank you, Madam Barbara, for your
Welcome.
information. Now, viewers can type your questions in the comment section if you have any doubts. Meanwhile, while waiting, Madam, I have some questions. Is it safe to use the medication after the expiry date if it has been stored in required conditions like dry and cold?
Actually, this question is a very, it's a favorite question to many. And a lot of people actually keep their medications beyond expiry date. This actually happens. Huh? As what I said earlier, see, manufacturers, they have a process where they test the resilience of the drug under certain conditions. Okay, they do a stability, do an accelerated stability study where they force the drug and they try to see how long it can last. So that's the only guarantee they can give you. Okay, but there are research done to show that potency of drug still is good even after expiry. Okay, even after expiry. But whether you want to take that risk or not comes back to you. Okay, comes back to you. Because if anything goes wrong, I cannot take the responsibility. The manufacturer will not take the responsibility. So who's going to take the responsibility? Right? So in terms of safety, there is a guideline. Okay, but definitely some drugs, even past the expiry date, their potency may still be within range. Okay, some companies actually retest. They retest and then they extend their expiry date. It's done also. When I was working in the manufacturing facility, we've experienced this, where we do the stability studies and then we try to see how long some more it can go. Right? So this is something very logical. Yeah.
Thank you, Madam. I have some questions. There is a question from the viewers. First is Melvin. She asks about, does the expiry date change if the medication is stored in the refrigerator after opening? And what is the purpose of the batch numbers in the medication?
Okay. Now you see, the question, I'll address the first question first. Mr. Melvin, the question is a very good question, by the way. See, it depends on whether the medication is supposed to be kept in the fridge or not. First of all, that's the first question. If it's not supposed to be kept in the fridge, then keeping it in the fridge is not going to help it. Now, expiration date will change when you keep it in the fridge. It depends. It depends, okay? Let's say now it's an antibiotic, reconstituted antibiotic. It has to be kept in the fridge. But after reconstitution, it only lasts 7 days. So beyond 7 days, you have to discard. You did store it in the fridge, but you have to follow the protocol, right? But let's say now you take a cream, okay, in a jar. You open and the standards say that it'll last 3 months after opening. Then you thought, I'll keep it in the fridge. Maybe it'll last 6 months. No. Why? Because every time we open such products and use, we are exposing it to environmental effect. Okay, so no, I would not recommend. I would still say that you follow the guideline as to the expiry after opening. Now, the second question, what is the purpose of batch numbers? Yeah, very good question. Okay, now, batch numbers are an identity. Okay, now let's say I'm in a manufacturing facility and we manufacture batches of tablets every day. Let's say a particular painkiller. Every day we manufacture batches, right? So I assign this batch number for every batch that is released. Let's say a particular batch has got a problem. Patient take it and they develop a very negative reaction and it's not safe. So now we want to recall back all the product in the market. So batch number will enable us to track back all this, to recall back all the product on the market, so that we reduce the hazard to the people. At the same time, when we go back to the manufacturing facility, we will be able to track the batch number and the history of the product. We will be able to see what ingredients we use, what packaging materials we use, all right? So a lot of history will be documented together with that batch number. So batch number is like our IC. With that IC number, you can see, how much of loan a person has, what disease they have in the medical field. It's a tracker. It's a tracker. It's something like an identity for the particular drug. Okay, I see Mr. Melvin also has another question. How should a patient with heart problems store their GTN tablets and they need to carry it with them? Is that it will reduce the therapeutic effect if exposed to sunlight? Oh, true. Yep. GTN tablets must be stored in opaque bottles. So let's say now you are on the go, you're traveling. What you can do is you can have a cold pack, okay, but keep your bottle inside, away from the ice pack. All right. And a cold pack is usually well closed, so it's also not translucent, so no light can travel through it. All right. That would be a good way. But these people who are taking GTN, the patients who are taking GTN, who are using GTN, must bear in mind when the first time you open that bottle, please write the opening date on the bottle afterwards. I mean, after you recover and you're well, please write that date, because that will determine 8 weeks later, you should discard this. If not, your next episode, it may not help you. That is the danger of it. Right? That's the danger. Thank you, Mr. Melvin. Liu, you have any other questions?
I have one more question. Are there any visual or smell indicators about to determine if the medication gone bad?
I know why you asked this. Because foods usually they let out a very bad smell when they expire, right? This is easy, right? When your food and your curries or whatever turns bad, it smells bad, you just discard it. For tablets, especially those that have got a certain type of smell, then there can be a change in the smell. I don't know, for smell, you have to be more sensitive. But if you think about it in terms of color, I'm sure a lot of viewers out there had experience with vitamin C. After keeping it, chinchai like that, just throw here, throw there on the cupboard, wherever, you find that your vitamin C develops spots. It was actually a very nice, smooth orange color. Suddenly, it started developing spots. Now you know that, there is a discoloration. That spots is actually oxidation happening within your tablet. So meaning your vitamin C is losing its efficacy. All right. In terms of smell, if the tablet has got a significant and deterioration happens, the smell may change. But that depends whether you're sensitive towards the smell or not.
So another question from our viewers. Vicky asks, can you provide information on how the medication's effectiveness may change as it approaches its expiry date after opening?
Information on how the medication's effectiveness may change as it approaches its expiration date after opening. Meaning to say, let me rephrase this and then we see whether this is what Ms. Puiki means. Let's say I have an eye drop and the eye drop's expiry is December 2023, okay, year end. But I open it today, meaning 4 weeks afterwards I have to discard this, right? By 20th of September, I have, not 20th, maybe 19th of September, I have to discard this, right? Okay, so approaching December, how is the effectiveness of this eye drop going to be? Maybe that is what Ms. Puiki is curious about, right? Okay, now the thing is, once you open the product, the expected stability graph will change because now you have got environmental factors coming in, the air, the contaminants, not to mention you yourself when you apply the drug. Some people, they will apply the drug, the tip will get into contact with their skin, they will touch the sides of the bottle, right? And all this is going to change the way the product is going to deteriorate, right? So definitely the effectiveness is going to drop. So there's another risk associated with this as well. Not just the effectiveness will drop, it may become contaminated such that when you continue to use it or you give it to someone else to use, they may develop some infection. Reminder here, please do not share your medications. Some people keep their eye drop in the fridge and then when someone develops eye problem, then they go like, oh, I have this, why don't you use it? Don't do that. These kind of medications are very personalized, okay? So I hope that answers the question of Ms. Puiki.
We have another question from Jahui. Can I use the medication beyond its expiration that it still look and smell normal after opening?
Controversial question. Controversial question. You are taking a risk on it yourself. That's all I can say because I would not recommend it as a pharmacist. I don't think it's ethical either, right? But you should not because expiration dates are set for a particular reason. It is to make sure it is safe and if anything happens within that expiration date, you can hold someone responsible for it. The manufacturer can actually take responsibility. If you go ahead and eat and something happens to you, you are at your own risk, you are taking your own risk. Okay, so that's why when you buy drugs or when you collect your drugs at the dispensing table, dispensing counter, check for the expiry date and you have a right to request for a longer expiry if you want. Go for that, right? Because that should be the way, right? That is safer for you as well.
Also got another question from Jiahui. Are there any specific storage containers or techniques that can help prolong the medication's shelf life after opening?
I'm afraid no. I would advise against transferring the content to any other container. I would advise that. So keep the drug within its original container. That itself will ensure it is good to use. If you are going to transfer it into another container, you are adding another risk point. And these things are not researched yet, I suppose. If there are enough evidence, enough scientific evidence, and FDA says, yeah, we can do that, then why not? But that could be in future. As of now, I think we should maintain our medication within its original container and follow the expiry after opening advice.
It seems like we have covered all the questions from our viewers. Thank you, Madam, for your clear explanation. Got one more question.
One more question. Okay.
May I ask where is the proper place to hand over expired medication in the hospital? Is it pharmacy department as I never see patient return any medication and it's good to spread awareness to patient during medication dispense?
Yes, it is the pharmacy department, definitely, because pharmacy department is the one that will be actually segregating expired drugs. Yeah, it's the responsibility of the pharmacy department. Good question and good intention to spread the awareness. Very good, Miss Yusniza. Yes.
I think we have covered all the questions. Thank you, Madam. Before we end our webinar session, Madam, do you have anything to cover before our recapitulation.
Thank you to our beautiful MC for hosting this webinar and giving me a chance to actually share my knowledge here. And thank you to all the viewers who have posed questions. I think your questions actually help the public get more awareness, right? So if there has been anything I said along the webinar that is a bit disturbing or hurt someone's feeling, I apologize for that. Nothing, no malice intended. All done in good faith. So I would like to wish all of you out there speedy recovery if you're on certain medications, and take care of yourself and also take care of how you keep your medications. Take awareness of that. Thank you so much.
Again, thank you, Madam Bama, for clear explanation. I believe that viewers learn a lot from you. Also, thank you everyone for joining this webinar. I would like to thank each and everyone for making this webinar happen. And I hope that you all will join our upcoming events for this World Pharmacist Month. And also, please take note that all these that's in our webinar. We have still got 3 more webinars in next week at the same time and also in the same platform, Facebook and YouTube. So see you guys in the next Monday at the same time, 2 p.m. Thank you for joining us.
Bye-bye.